Hi everyone, Dr. Keith Mirante here, and I often get questions about the jaw and jaw pain, or as most people refer to it as TMJ. TMJ is actually a joint, temporomandibular joint, and it's the dysfunction of the joint that what causes people pain. And there's lots of people out there that suffer with jaw pain and discomfort, and it's oftentimes debilitating. They have tons of pain in the jaw, or facial pain, or even headaches. And to treat the TMJ, there's actually two main components of the TMJ that need to be taken care of. And so very common, there's a relationship of upper neck or upper cervical spine dysfunction or damage that can contribute to the jaw, because when your head either comes forward or to the side, it's going to create a new position for the jaw. Also, we have to look at the jaw itself, and those two areas, the jaw and the cervical spine, are very interrelated with each other, and if one is out, it can cause pain in the other area and vice versa. So let's take a look at what we need to do in terms of looking at the jaw. First and foremost, we have to do a very thorough examination of the cervical spine. The cervical spine can be damaged due to either lifestyle issues or traumas, and very common, the most common injury to the cervical spine and its relationship to the TMJ and dysfunction of the TMJ is a whiplash injury or a car accident. So let's take a look at the jaw itself. And so this represents the actual condyle, or the inside of the joint space, and this actually represents the lower part of the jaw. And it actually acts as a hinge when we open our mouth or when we close our mouth. And this red thing that we see here, that's called the disc of the jaw. And what happens is, when there is a damage to the jaw, the disc, what will happen is the disc is typically acts as a cushion up here. When there's a dysfunction of the jaw, this disc is pulled in this direction, forward and down. And what happens is that disc will slide over the jaw, the bone of the jaw. And what happens is this creates a clicking or a popping of the jaw, and is often associated with lots of pain of the jaw. You see these two blue things, these are muscles of the jaw. And when there's dysfunction or damage, what happens is oftentimes there's going to be a spasm which pulls this disc forward and down, and that's what creates that clicking and popping over that jaw. And so in order to take care of cases like this, oftentimes what the most important thing to do is a very thorough evaluation of the neck as well as the jaw. And we take very detailed measures of the jaw in opening, in translation from side to side, and we need to find exactly where the cause or the start of the problem is, and to create a good game plan moving forward. Once we do that, we're armed with some ammunition to be able to start taking care of and treating the jaw to get effective treatment and effective reduction of not only symptoms and oftentimes clicking or popping in the jaw. Sometimes it is too far gone to actually get the clicking or popping to go away, but oftentimes there is good relief of the jaw pain. And so once we have a good treatment plan established, what we'll do is we're not only going to do in-office care, but we also very important is the home care and the follow-through care. That's probably one of the most important things besides being in the office that we do. We have to treat the muscles of the jaw, the muscles of the chewing muscles, the temporalis muscles, the masseters, the pterygoid muscles, and create a treatment regimen that's going to effectively reduce and normalize the motion. Last but not least is one of the most important things is I also work with your dentist to create an effective treatment program. As we start changing the jaw function and structure, what also happens is now the teeth may be in a new resting position. And so the dentist will also be very instrumental in creating a bite guard to prevent clenching and gripping in the jaw to alleviate some of that discomfort. So please ask away. If you have any questions, please ask myself or anyone in the office. We'll be happy to assist. And also, be very important that you let me know, and I'll be working with your dentist and how do we treat this the most effectively to get you relief of your TMJD or temporomandibular joint dysfunction. Dr. Keith Mirante signing out. Have a great day.